I'm Kisha Holden, and it's just wonderful to see everyone here today. Carolyn and I have been working together for quite some time on developing a model for developing the mental health in the African American community. To get organizations ready and medical institutions as well as healthcare institutions ready to implement the Affordable Care Act. And I'm pleased that at least one of the important components of that has been elevating the role of mental behavioral health and trying to have it on the same level or parity with physical health.
Dr. Holden, thank you so very much. And you all, I promise not to cry. I take that back. I just might cry for two reasons, because this is really personal, and I'm just so elated to see that you took time from your busy schedule to come in and find out what we want to do to address this problem. My niece, who was more like my daughter, had everything going for her. She was drop dead gorgeous. She made all A's in high school and college. She had a beautiful Lexus, and I wanted it. She had a beautiful house, 2 sons, and a loving husband. A very profitable daycare center. She started having a mental meltdown. And when I heard that over the phone, I told her husband, bring me my baby. And he did. Day 4, she had a psychotic break. I did not see that coming. And you know what all the rest is. So when that happened, I said, okay, I could do one or two things. I can crumble and just die, walk around dead, or I could fight. And when I was in the hospital, I chose to fight because she had such a beautiful life, and I refused to let her life and her death be in vain. So when I was in the hospital, I had to learn to write with my left hand because I almost lost my right one. And I said, when I get out, I'm going to start an agency in her honor. So July 4th weekend, 2011, the movement started. We would have community outreach specialists to go into the homes, and the families will be referred by these partners. Now, we're not going to just pick people off the street yet, because they have to come as a referral. We want to have a conference each year in Atlanta, of course. We are working on a network of mental health professionals. We want to have workshops, seminars, and we want to be able to conduct some training for primary care doctors. Why? Because when we feel weird, where do we go? To our primary care doctor. And they write approximately 3/4 of the prescriptions of psychiatry. We have to do it. It's not going to be top heavy. This is program driven. It's grassroots. We want to raise a lot of money for the participants. We got to have a staff, and we've already identified. We got a whole group of people ready to go, PhDs, MPHs, everybody's ready to go. Professional counselors, we got CPAs, we got attorneys, we got program coordinators, we got event coordinators. We have a whole staff sitting on the sidelines ready to go. Another thing too that we want to address is there's only 2% of psychiatrists, 2% of psychologists. Oh, you fit right in there. You wanted 2% somewhere. And 4% of social workers in the U.S. are African American. That's pathetic. So we want to be able to go into the high schools, do career fairs, starting with the 9th graders, and say, you know what, take a look at this as a possible major.
We used to be embarrassed when we have a particular problem, as far as talking to therapists, as far as having a relative. A lot of our females, daughters, sons, cousins, relatives are incarcerated because they really, truly have mental health problems. So I want to be, as far as a person of an instrument, is with the pilot program to enhance and encourage and to assist in every way possible.
I have an extensive background in law enforcement, and so I'll be the judicial advocate for the program, and I'll also be trying to handle the initiative with that. Just trying to establish a partnership with the courts. I'm dealing with inmates a lot, for statistics, and I'm going to elaborate on that, but more than half of our inmates, African American, have mental health issues.
I'm going to be working with community outreach and actually going to the families and doing the assessment, family home assessment, doing the psychosocials, actually talking to families, developing a rapport, just being able to be sincere and relate to family members as they disclose their information in regards to mental illness, because that is a very painful situation with families. So I'll be working individually with them, and I'm their direct source as far as a face-to-face contact with our program.
I think that mental health in our community is a very important issue that needs to be addressed. A lot of times we just suffer silently, not address the issues and not deal with it. So I think to bring it to our churches is a plus. I've already went to my pastor. He's already agreed to have a symposium conference there, so we're already on board to put it out there so that the community can be more
My name
aware.
is Walter Hughes. I am the Associate Pastor of Visitation and Congregational Care at Ebenezer Baptist Church on Auburn. And the pastor has given me the directive of launching a social services mental health ministry for our congregation. We have a lot of our congregation or congregants who need counseling. And so, and my background is clinical mental health. So I have been giving that directive. So that's why I am here, so I can learn what's out there in the community and really collaborating with this organization and getting that launched.
I'm project coordinator for a nonprofit between Mercer University and Piedmont Healthcare. And so a lot of the emphasis on mental health and behavioral change is coming down the pipeline for medical homes or extensivist clinics is what they want to call it. But a lot of the focus isn't on us, isn't on disadvantaged populations, isn't on minorities and underserved populations. And so I think this organization will help fit that need and kind of incorporate that into the change in patients.
And over the years, I've worked in various areas of healthcare. Started off in health administration, and I worked with the Clayton Center, which is the mental health component of the Clayton County Mental Health Agency. They had a program, comprehensive behavioral health care, and I served as a forensic counselor there. Later went to the Clayton County Board of Health and started the men's health program there, the first one they had. And Community Voices was one of our partners, and that's where I first met Dr. Braithwaite Holden. And I've been knowing Carolyn for a number of years. Can't even remember. I think it was West End Medical Center. But
Way back, 1980 something. Ooh, you know how old we are, young.
My name is Julian Fennell. I'm here by way of Carolyn, as I'm sure a lot of us are. So I'm looking around the room, and everyone's Carolyn, Carolyn, Carolyn. But when I walk in the room, she's like, Julian, Julian, Julian.
Makes my little heart throb.
I don't know. I mean, I guess this is my dissertation, right? So I'm from a small town of Wilmington, Delaware. 37 years old, so I'm still young, I guess. I met Carolyn, I started as a small moving company. That's how I met Carolyn. Young lady from Fitzgerald, met a man from Wilmington, and now I'm here today. But I want to say that this is something that's personal and very dear to her. I'm involved 100%, so she just had to say, Julian do this or Julian do that, and I'm here. Like I said, I'm gonna make it long and extensive, but pretty much that's my background, and then I have a moving company. And I brought Mr. Aker on board, I got my brother here, Lambert, on board, and now we're kind of, you know, I don't want to take the cliche of we started from the bottom, now we here. So all this is due to Carolyn, who kind of kicked me in the butt and pushed me to be more than I even expected of myself. So with her incident, and that, it's just, it was one, now it's a few that can grow into many. That's right.
All right.
So, and that's what we're hoping for.
That's
So,
right.
hey, all lit.
And try to figure out what resources are needed, what services are needed, and how we can actually provide those. So one of the main purposes for me being here today is to kind of get more information, because mental health is actually my background. I did psychology for my bachelor's and master's for public health, and that's something that I'm always interested in learning more about, because I know the need in our community.
This program, and we're really seeing how more effective, having community health workers in place is really playing a role for the physicians as well. We're finally getting the project ongoing. And one of the things that Grady really brought to the table and really have a concern with is the mental health component. And it was really great when Yanira shared this information with us, because now I can take it back to Grady to say, someone is out there. I can also take it back to United Way to say that there are programs out there that are setting up for this, to even try to put you in those connections with those people for the pilot program as well.
I served 12 years in prison. I just got out about a year and a half ago. And after coming out, me and my partner, we started our own business. I got 2 houses, 3 cars. So my testimony, I go back into the prisons, the county jails, go back to the projects, to the drug dealers, the gangbangers, and I show them my testimony. You know, I don't only speak it, I don't only preach it, I show them what I can do and what they can do as well. So we have a mentor program that we got going on, and we doing good. And this organization, because brother, he's trying to start, he already started a nonprofit. He's gonna tell you about that. So what we're gonna do is try to take what information we can from here and take it back to Macon and see how we can incorporate it with what we got going on and probably jump on board with what you all doing.
I got an entertainment company. We deal with spiritual plays. We use the spiritual plays to take some of the synergy to the nonprofit, so we can have free screening for the people. So we got a lot of things going on, and we trying to build the money so we make movies. So we trying to get the movie industry so we can take the movies and inspiration movies, so we can take it and educate people to the nonprofit and help do workshops everywhere all over the world. So we got a couple of things, so I'll be working hand to hand with the sister so I can get some more information on, so we can get more better than what we're trying to do.
Good evening, everyone.
Thank y'all.
My name is Anchor Avery, and I'm here by way of Julian, Carolyn, and Lambert. I work very closely with them on pretty much on a day-to-day basis. One of the things is my background is very diverse. I have one of the things that I like to do is kind of bridge the gap between the street and the boardroom. And what I mean by that is that a lot of times the initiative that we're actually embarking on right now, we need to impact the people that can be most beneficial to the message in which the organization will bring. So I will be working closely with everyone in the organization, from doing contract writing to business writing to also initiatives to generate funds. So if anyone is actually working with fundraisers and anything like that, I'll be working closely with them to generate funds and things of that nature, and also to make sure that we take the message to where it needs to be implanted to those people that can impact.
Also an instrument to get this program out, because we really need it in that low income. Most of them are single parents and they need help with mental illness and all type of issues that they're dealing with. And I'm gonna be an advocate and just an instrument to bring some people on the board in the program, because we really need it.
I met Carolyn was through Fulton County. So I was contracted to do primary care services through Fulton County at a place called Neighborhood Union Health Center. So I was primary care physician there for about 2 years. What we did was pretty unique at the time, and we really focused in on integration of care. So integrating primary care with behavioral health services, which we know that the need is great. And we've seen the push for that, and that's been basically the wave of the future as we see and what is happening now. I can say a couple of things. One, it is dear to my heart. One, because I love Carol. That's number one. But also because I am the gatekeeper, and those who are like me, primary care physicians are the gatekeeper. So we usually see those who have behavioral health issues and concerns prior to the psychiatrist or any of the other doctors. And we look at the whole person, which is so important. So it's very important for us to be able to be trained through organizations like this to be able to readily identify.
Today is a continuation of several conversations and meetings and and work that we've been doing, and we keep seeing ourselves grow and build, and it's for a reason. It means it's time. The time is now for us to actually act and engage and do the work that's necessary to promote mental illness, mental health, behavioral health, which includes mental health, substance use disorders. And so I too want to just commend Carolyn for taking the leadership role. It takes leaders like you to mobilize and stimulate interest in us and action so that we can do what's necessary. So you have been a champion, continue to be a champion, and we appreciate you. We celebrate you, and we commend you for being able to even be up here today even talking about some of these issues. I mean, it takes a lot. It takes a lot when you've had such a personal experience. And so I think the legacy that you're continuing for your niece is remarkable, and I can't say enough to emphasize or re-emphasize just how pleased we are and excited and proud that we're all are for what you're doing.